for coming. That's Cynthia, and there's the equipment we're going to talk about today called the ONDAMED. But before I get into that, I want to give a little background, because when we talk about alternative treatments to medicine, you know anything, Cynthia? No, because I want to continue to do this. Maybe we need to do it in the back. So or can you do it without talking?
Okay.
Can you do it without talking, you think, a little bit? All right, because I like, so people can experience it a little bit. We'll do it as I'm giving you the information about it. Who wants to? You want to try?
Yes.
Have a seat. So anyway, the background I want to give is because this is obviously not mainstream medicine. Mainstream medicine uses drugs, surgery, chemotherapy, radiation. And the one thing mainstream medicine doesn't really do anything is prevention. There wouldn't be any mainstream medicine if nobody got sick, right? And yet there's a big demand for keeping people healthy, but nobody's addressing it. I mean, I know all of you here are addressing it on your own terms, because that's the only one that really can do that for you. So the background I want to give first is what mainstream medicine does. And today's mainstream medicine really goes back to Abraham Flexner. Does that name ring a bell with anyone? Abraham Flexner, back in the early 1900s, was employed by Carnegie and Rockefeller. And the reason they employed them, Abraham Flexner, is they had just bought pharmaceutical companies. So they had these drugs, and they had to figure out how to sell the drugs. So they employed Abraham Flexner to go around all the medical schools, and at that time, nobody was using drugs to treat problems. They were using natural remedies. And Abraham Flexner went around offering these medical schools lots of money to change their curriculum and how they taught doctors. And now, and it changed. In other words, instead of trying to get people well, they just wanted to treat symptoms. Because that's all drugs do, is treat a symptom. Think about it. If you have high blood pressure, the drug will lower your numbers, but it won't get you better because it doesn't remove the cause of the high blood pressure. If you have high cholesterol, the drug will lower your cholesterol, but it doesn't remove the cause of the high cholesterol. If you have diabetes, the adult onset type, it'll lower that blood sugar, but it doesn't remove the reason for the high blood sugar. But that's what mainstream medicine does, is sell drugs to treat symptoms without addressing the underlying cause of the problem. So that's one thing that happened in the early 1900s. And then when you go to medical school, the first 2 years are addressing what they call basic science. They teach you anatomy, physiology, pharmacology, microbiology, and the next 2 years are more of the clinical sciences, where they teach you what to do with patients who have a problem. And the problem is always called the chief complaint. So if you have a patient, if you ask them, how do you feel? I feel great. Doctor won't know what to do with you, because they're taught to address the chief complaint. So if you don't have a complaint of anything, they don't know what to do. Now, what could a chief complaint be? Someone might come to the doctor and say, well, I have these headaches. Well, I mean, there are lots of causes of headaches, and of course you would want to rule out, if the duration of headaches is sufficiently long enough, you want to rule out a brain tumor, of course. But of course, that's compared to all the other causes of headaches, it's very rare. You have tension headaches, migraine headaches, headaches related to allergies, and the doctor would do the same thing, go through a whole list of questions and maybe some diagnostic tests, and at the end of the day, he says, here's a prescription for the pain. But really didn't address why you got the headache and what you can do to remove the cause of the headache, so you don't need to take a prescription. And the same thing is on and on and on with blood pressure, with high sugar, with cholesterol. At the end of the day, he says, here's a drug to treat your symptom rather than address why you're getting sick. And then when I got down here in Florida in around 1981 exactly, I used to listen to somebody on the radio named Dr. Dan Reed. Anybody remember that name? Somebody, 2 people remember Dr. Reed. And I knew Dr. Reed because I went to one of his lectures in his office. And he would lecture, well actually he would, on the radio show, interview patients. So what he did in his office was chelation therapy. And I'd hear him interviewing his patients, and they were talking about leg pain or intermittent claudication and how that got better with chelation therapy. He would talk about chest pain, angina, and how that got better with chelation therapy. these patients were, you know, corroborating. You know, it's one thing for the doctor to say how great something is, but when you hear it from the patient, it takes on a little added value. And I said, boy, they never spoke about chelation in medical school. And you never heard of anybody getting better with the intermittent claudication or the angina without surgery. So what's this chelation therapy that they never spoke about? The interesting thing is, the history of chelation therapy really dates back to the 1940s. That's when it was discovered accidentally that it helped circulation problems. And the way they discovered that was people who were poisoned with lead. These were Army personnel that were painting with lead-based paints, and they got exposed to too much lead. So they went for the approved treatment for lead poison, which is the use of chelation therapy with EDTA. And coincidentally, some of these people suffered from angina, heart-related chest pain. And during the treatment to get rid of the lead, their chest pain went away. And that's when the connection was made that there's something about chelation therapy and circulation. So they repeated you know, somebody made that observation. They said, boy, this is amazing. And the other thing I want to point out too is this was a discovery. This wasn't a made-up treatment. You know, bypass surgery is a made-up treatment. But this was a discovery. You know, as a side effect of treating lead poisoning, people got better in other ways. So they repeated the study where they got a lot of people with angina, and they did chelation therapy on them. And typically the protocol for chelation therapy is 30 treatments. And after 30 treatments, which will be finished in usually 15 weeks, you do 2 a week. So in 15 weeks, just about 4 months you finish, and they ask the people, how do you feel? And most of them said they didn't notice anything. So they thought, well, maybe this was just a fluke and it really doesn't work. See, the mistake they made at that time was they evaluated the people, they asked the question too soon. So they went back about a year later and asked the people, about 90% of them said they felt better. Because removing the heavy metals from the body just places the body in a position to start healing itself. So at the end of 30 weeks, patients were just beginning to start the healing process. So what are the heavy metals? Lead, arsenic, cadmium, mercury. Those are the things, if you were to be measured, you would find that in your body. And the older you are, the higher the accumulation of those heavy metals. So what does this have to do with ONDAMED? And ONDAMED would be under the category of vibrational medicine, or which is a good one, or electromagnetic field medicine. I think mainstream medicine might call it other things. But they would classify it like they would classify chelation therapy as quackery. You know, this is, but the definition of quackery by mainstream medicine is anything that doesn't make them money. See, they call it quackery, they say, oh, it doesn't work. But that's not true. It works. I mean, they wouldn't make a big deal about chelation therapy if it didn't work. Why would they care? But if you remember a few years ago, I think now it could be 8 years ago, maybe, or 10 years ago, the Board of Medicine in this state was trying to outlaw chelation therapy. And you had big turnouts at the hearings and everything, and they stopped that process. So what that did for me, so I came down to Florida in 1981. I started doing chelation in 1990.